My name is Marcus Frazier. I'm the Director of Engineering for Engineered Care. I think Dr. Jack wanted to start the session though.
There have been a few questions about whether or not the slides are available. And the slides, yes, of course, are available for everybody. And that the slides go along with the toolkit that we have developed. And there are 6 tools, and they very much parallel the presentations that are given today, so that we will distribute. I don't know, David, the best way of doing this, but we could. Yeah. Okay, good. So there'll be 6 tools, and there's over 100 pages of text that go very detailed, and the slides go along very closely, are aligned with what those tools are. So there'll be 6 tools, each tool with a slide set, and those will be available for everyone to review later. So the afternoon sessions, we started out kind of with the big picture, and then are gradually moving down into more detailed parts of the implementation process. And Marcus will talk about the workstation, and that the workstation is a piece of software that when the data is entered into it, a nurse on a ward could simply push a button and print the after-hospital care plan, then go teach it to the patient. Now, the efficiencies involved in all that are obvious. And the more that the workstation is connected into the hospital IT environment, the more flows automatically and there's less redundant data. And for efficiency purposes, in busy places like yours, it seems like it makes a lot of sense, and that's why we're presenting that today. After that, we're going to spend a session where David and I together, David will be talking about how you will be implementing Project Red, and we'll go through some of the areas that hospitals have some difficulty with, and go back and forth about what some of the options are. And at each of your sites, even, you can think about how you're going to implement at your site, because it could be very different from one VA hospital to another VA hospital in terms of who's going to do which pieces. So that will be an interactive session to be thinking about really what are the next action steps for each site. Then we'll make a presentation on the phone call that's a little bit shorter than some of the others, talk about what the steps are, what the components are of how to do that. And then a little bit at the end about how to measure the RED processes and outcomes and what to measure to show that you're doing a good job. And then we'll wrap up at the end. So so progressively more detail as the day goes on. So Marcus will talk about the workstation now. Thank you, Marcus.
Hear me? Perfect. Okay. So what we have up on the screen here is called the RED client. This is a piece of software that sits on the nurse's laptop, workstation, shared computer. And this piece of software is used to create the after-hospital care plan, to print the after-hospital care plan, and then to perform the follow-up phone call intervention. So we'll just jump right in here to publish AHCP. And what we're going to look at here, we have a list of patients that are ready to receive their after-hospital care plan. And this ideally is hooked into your ADT feed, so as soon as a patient is admitted, they're going to show up in this piece of software. So this isn't going to be a mad rush to create the booklet at the time of discharge. The information is being added to the after-hospital care plan as soon as it's available. So we're just going to go ahead and work on this patient here, Martha, today. This list becomes very long very quickly. We have some search functionality up in the top right. We can also change the view here to look at people who have already received their booklets if we need to go back last minute and change something in a booklet that's already been created. So for now, we're going to work with Martha. And when we open up this patient's record, what we see over here on the right, we have a green light, red light system that indicates to us what components of this after-hospital care plan have been entered and which components still need to be entered. So right off the bat, this is telling us that we have the discharge medications, the appointments, the provider, diagnosis, and then all the red lights are things that we still need to add. Yes? I'm gonna talk about that. But so this is an example right now. This is sort of what this workflow looks like. Um, we have sites all across the country using this software, and basically this software can be used, for instance, in the complete absence of an EMR. So I can come in here and I can enter in data for everything in the after hospital care plan and do that. We can also integrate every component from an EMR, and that's the goal. We want to reduce double entry. We want to have everything pull over, and that's something that we're working with your IT folks to figure out. But that is the goal. The hybrid approach, which is very common, is that we focus on getting the discharge medication list, the patient information, and anything else we can get, allergies, diagnosis, that's great. But there are going to be some things here realistically that we're going to have to use the software to enter. And that's what we're going to be walking through today. We make it as easy as possible to enter data using this software. Lots of these fields are just simply selecting from a drop-down list. So I can, for instance, type congestive, it auto-completes, I hit save, and now I've set the diagnosis. So it's very straightforward. So looking at this patient status tab, at any point you'll see down here we have a print AHCP booklet. So I can come down here at any time and just print a copy of this booklet or produce a copy of the booklet to see what it looks like so far with the data that we have. And I don't think, have we shown, oh yeah, you did, you showed it earlier, but this after hospital care plan here, you see is generated from this software. This logo here is replaced with your logo, the patient's name, discharge date, and then down here we have the PCP name and phone number, discharge advocate name and phone number, and that's configurable in the software. So this is the discharge medication list that we have just pulled from the software, color-coded by time of day. I'm not going to dig into this since we've already reviewed this today. I'll show you how we can add additional medications. And now we have the diagnosis, and we have one appointment here. We have the PCP follow-up appointment. You see we have the date and time, the type of appointment, the provider, the location, the reason, and the phone number. So all the information the patient needs about that appointment. And then the software will automatically take all those appointments and put them up onto the calendar so that you have the discharge date, the calendar shows the appointment dates and times. And so they, like Dr. Jack was saying, you can just put this up on the refrigerator and they have all of their information. We do 2 months of calendar. And then here we have the additional information about the diagnosis automatically added depending on whatever diagnosis is selected in the software. Here on page 8, we'll see that we have an exercise and diet recommendations section, but they're empty right now, so we're going to go back and add those. We have one allergy to penicillin, and we have a pharmacy that's missing, so we're going to go back and add that.
Marcus, I think you did mention, though, that this is adaptable for each center. Like for our group, we really wanted, when we move forward with this, we'd like to have 3 months calendar. Since we're looking at reducing 90-day admissions, we'd like to be sure that we've got things in place for the full 90.
Yep. We do customizations for every site. Some things we can add additional pages to the booklet, like a signature page at the back, so it's actually the discharge document, adding additional calendar pages, diagnoses, etc. So here on the last page we have, this is the patient activation page. We talked about this earlier. We plug in the patient's PCP appointment up top, just so that they're very clear that these notes are for this PCP follow-up appointment. Down at the bottom, this is blank right now, but this is where we can place those pending test results for the PCP. So we'll go into the software and add that as well. Are there any questions at this point about the booklet? Sure, go ahead.
A lot of patients from the area that I work in go back to Hawaii for their care, or out of our. Can this be pulled up at those sites?
So this is a PDF document. This can be emailed, transmitted, downloaded. I mean, however you want to transmit this.
I see, but they wouldn't have access to the document on the computer like they would other
with this
parts
software.
of it. Okay.
Go ahead.
One thing that was mentioned earlier by, I believe it was Chris, saying that since it is PDFable, that it could maybe go into Vista imaging tools,
Sure.
So then it's accessible.
Any other questions? Yes.
Okay.
No snacks.
More chips. Can you customize the book to diagnoses? For example, CHF, could you add a weight chart just for that diagnosis?
Yeah, that's actually something that we're doing right now. Was there another question? Great. Okay, so this is you have the draft watermark here. So this is just a draft version of this document. We're going to close this out, go back into the software, and add some data using this software. So we have these tabs in the top right. These tabs are for entering data to the patient's record. These tabs over here on the left are for viewing the data that's part of this patient's record. So when I look at the medicine tab over here on the left, I can see the medicine that we just looked at in the after hospital care plan. So we'll look at the patient status tab and look, we, for instance, need to add a pharmacy, the diet, exercise. So we'll go over to the pharmacy tab. And it's pretty straightforward. We have a list of pharmacies here in this drop-down. We select this patient's pharmacy from this list. We have the city and address here for convenience. I hit save, and this pharmacy pops over onto the left-hand side. Go to the patient status page, and now we have the pharmacy as a green light. And if I were to print the booklet again, we'd have that pharmacy's address, phone number information in the booklet for the patient. So all of that information, the address, phone numbers, that's all stored in our database. So you're not having to type this out every single time for the booklet. I'll get into this in a little bit, but we maintain the list of physicians, pharmacies, health centers, DME providers in your area. And then we can go ahead and review that list, edit providers, add new providers, delete old providers if we need to, and then we can also work with your IT folks to sync that over from your EMR so that you're not having to add these things every time a patient has a new PCP, for instance. So we'll go ahead and add some more data here. Allergies, we have penicillin. I can add as many allergies as I like here. This is another example of this auto-completion where I start typing and it gives me options that match what I'm typing and I select it from the list. Just so you don't have to search the entire list. Here for diet, I can choose a diet recommendation from this list here, something like only eat soft foods, do not drink liquids, or I can go down here and just type in my own custom recommendation. There's something that's not found in the list. I can also do both of these together and both sentences will appear in the after hospital care plan. So we'll just say eat your regular diet, save, and let's say I did a custom diet here. Save. And now at any point, if for instance something changes or I don't want this anymore, I just select this, delete, and that's gone. So same thing here for exercise. We have two options right now, walking, getting out of bed, or three options, and exercise as recommended. So I can either choose one of these if that's appropriate, or I can go ahead again and enter my own custom recommendation. Moving on to directives, I can place something like a DNR, DNI, DNH directly in the cover of the booklet. That's appropriate. This is optional, so I can leave this blank, or I can explicitly put this full code here. I'll put this on here just for this demonstration so we can see how that works. So pretty easy to move through these tabs here and add this information. I can go down here, open up this drop-down of available lab tests, and I can say the patient had a blood test done, and those results were not available at the time of discharge, so I want to make a note for the PCP to provide those results. I can choose the date that this was done, let's say yesterday, and hit save, and now we have a blood test over on the left. And then finally, for equipment, I can choose something that the patient should have at home here. Let's say home oxygen. I can choose the DME provider. This is optional, but I can say this is where you can go and get this, or this is who's delivering this for you, so you have that information. You can optionally place a contact name here and save this. So we'll go back. Now we have data for every component here. And let's actually just, while we have this in here, we'll go and see what the booklet looks like so far, and then we'll come back and do some more things here. So now here in the cover, we have the DNR. We haven't changed the medication list yet. We'll go and do that. We'll add some more appointments. Right now we still just have one. Now here on page 8, we have the exercise and diet recommendation we just selected. We have the pharmacy information with the address, phone number, the home oxygen we selected, as well as the DME provider information. And then on page 9, down at the bottom, we have a note for the PCP to check the results of the blood test. Any questions on this so far? Great. So we'll go back into the software. Yes.
You guys are bad.
Can multiple providers be entering information on the same patient at the same time?
That's just what I was going to talk about. Yes,
Awesome.
that's a great question. Yes.
It says DNR on the front of this booklet, but that wouldn't be like a legal document. Is there any concern that a patient might think it's a legal document? Do you know what I mean?
So
Can we provide like a copy of their advanced directive maybe with it?
that's a good question. I don't have the answer for that. I know that some sites do choose to use this as a legal document, and we put a signature page at the end. As far as the directive, I'm not sure if. Yeah.
Yeah, I think that's something that the
Good question.
ARC group, as they're working on rollout, this is definitely something we would need to look at because I had a concern basically the same. And so, welcome to the committee.
Nominated yourself. So for the first question, yes. So this workflow component here, like I mentioned earlier, let's say that the patient was just admitted and I had a conversation with them about their PCP, and I came in here and looked at their provider. I added their PCP, and then that's all the information that I had. I can come in here and say, okay, I set the provider information. This is now correct and complete. I hit save, and this tab turns green, and this status moves to complete. And now what this does is now I can close this out, and I can come back later, and this is a reminder to myself of how much work I still have to do with this patient. At the same time, you can imagine a scenario where one person's making follow-up appointments, another person is adding diet, exercise recommendations, and as part of the process, we would identify who's doing which components of the booklet, and then they would all come in here and mark their section as complete when they're done. Multiple people can be working on one patient record at the same time, and once that booklet is completed, basically all the tabs up here would be green, the booklet's ready to go, and then someone would basically approve the booklet and say this is ready to be given to the patient. And then the final version is printed out. Yes. Question.
Under the lab tests, I saw that it said lab test done on X date and need
Sure.
to be followed up. What about if you ask the patient to do a lab test after discharge,
Yeah.
but prior to their appointment? Is there a way to note that in there?
Sure. So anything that's occurring in the future is an appointment in this software. So right now we just have that PCP appointment. Well, you can come in here to the appointments tab, open this up, and you see we have all types of tests and things that can be done in the future. Let's say we want to schedule a blood test for the future. Same situation here. I select who this is with, and I can either have this appointment occur at the provider's location, which is specified here, or at a health center, which is specified here. Let's say this blood test will occur at this health center. I choose the reason for this appointment. We'll choose for your next test. Date and time. So I can open up this calendar again, and let's say this will occur on Monday. And we do encourage, making these appointments before the patient leaves, but some sites can't do that, and so we have this option for no date, and this will just say blood test call to schedule. It'll list out the address and phone number information. And then some people say, we'll do this in 2 weeks. So we have a date, but we don't have a time. We don't actually have an appointment. So this will list out the date, place this on the calendar, but this will still say call to schedule. And we'll have the phone number and address for the patient. So for this case, we'll just choose the date and the time, 10 a.m. and save. And then one other option we hear is to make a recurring appointment. So we'll choose physical therapy. Let's choose this provider. We'll have this occur at Seattle General. Let's have this be, so make sure your health is getting better. And as for a recurring appointment, we'll choose the start date. So let's say Wednesday, 2 p.m. And we'll have this go weekly for 4 weeks. save, and now we have 3 appointments over here on the left. So I'm going to go back and say the appointments are now completed. You see right here, before I print the booklet again, you see up here we also have the admission date picker, discharge date picker if we need to change any of that. You can also easily choose patient as a smoker, and if you have a hotline number or anything you want us to use there, we can plug in that hotline information so that they have that in the AHCP as well. So we'll print this again with the updated appointment information. And now here we have 3 appointments. The blood test in pink, the PCP follow-up in green, and then the recurring physical therapy over in yellow. And you'll notice that we take this color coding and place these onto the calendar, and now we have 2 months because the physical therapy runs into September. Any questions on the appointments? Sure.
I don't have to say anything. I just go up, and Pavlov.
Fear.
There were no potato chips, by the way. Oh man, I had the wrong question. Can you do telephone appointments?
Can I do telephone appointments? So there's no location? Oh, interesting, yeah. Yeah, we don't have that. That's something we could easily add, but it's not in there right now. Yeah,
we've talked about adding a phone follow-up page, like to formally make the. We've talked about adding a page into the document for the post-discharge phone call within 48 hours to help them understand when it's coming, and really make that a formal part of this document. But we haven't added that in yet, so. Every site that we work with, there's a whole list of things that we improve and we look at, and I'm sure we'll do this exact same thing with your group. So,
if we could just repeat the question when it's asked.
Yeah, I mean the phone call could be put in as an appointment. It's just I understand what you're saying. I mean if you put this in here and you leave out a health center, it will just display a phone number, but it might not be clear that they have to call that number or that they will be called, as opposed to having to call that number. So that's something that we could clarify in the software pretty easily. Is there another? Yeah, so.
Please repeat the question.
Yeah, is there a question to put the hours of the lab in? There is not right now. But again, that's something that's pretty easy to. It's just, so would that be a set thing that you would have for each lab? Okay.
This may be more so for the clinicians, but have you seen any resistance to patients who have been diagnosed with HIV, psychiatric issues, not wanting to have the medication and why they're on it stated there? Just, of course, I'm guessing you would not place it there, but just have you seen or had a lot of experience with that?
I can definitely think of a situation recently where somebody would say, my family knows nothing about my status, I don't want to know it, and if that went home at my house, they'd be very upset. I didn't hear it.
So it's the patient has the option whether what to do with it. Staff in the hospital will teach the information in the iPad. The patient has the option of taking it home and putting it on their refrigerator, but of course certainly doesn't have to do that.
But we're also sending this to primary care physician. This is protected information. We'd have to have a release of information for HIV, sickle cell anemia. What it brings up, though, as far as the discharge educator, is to be aware who's in the room when you go in. Just like, you don't know if your patient knows the diagnosis. You may not know who's in the room, and it's usually my universal precaution to ask, is it okay to talk with your company or should I come back? Because they may not want to talk.
Just throw the microphone at her. Just throw it. I don't think she can see the videographer over here. So next person, just throw it, Mike. Direct order.
I'm sorry. But I didn't get any chips at lunch either.
That's another question.
What about things like treatments, dressing changes, splint rotations, anything like that? What can you add tabs for specific
That's something that we've been, yes, that has been requested before. Right now this focuses on medicine, but we have been considering adding some of that.
You don't have a miscellaneous text box you could put things in?
So maybe this is a good time to jump into that. But the reason we don't have a miscellaneous text box is because we actually translate this booklet into different languages. And so because everything is being selected from a drop-down, we can go and translate all of that into Spanish, Chinese, etc. And you can, create this booklet in English and then print it out and give it to a Spanish-speaking patient. So if we just had free text, sort of, here's how you take care of yourself, we couldn't translate that.
So what are sites doing in those situations when they use this
Writing
tool?
it onto the booklet, if it's something like that. But if that's something that is critical, we would talk about how we can display that information, how would we design it. We would translate it all. It would actually be a feature addition to the software as opposed to just a free text box.
Does the software keep track of who entered the information?
That is a great question, and yes, it does. We have an audit log of every activity performed in the software, and so as an administrator, I can come in and say, I want to know everyone who touched this patient record, and it goes down to, user 1 added this medication, user 2 added this appointment, user 3 discharged the patient, and so you can track the entire, everything from log in, log out, everything you're doing in between.
So if there's a discrepancy, you know who you can
Exactly.
go to find out where they got that.
And it's also a great way to figure out, we talked about this, multiple people working on one patient record. If there's any breakdown in the process and 2 people are adding medications, you can go back and see maybe there's a miscommunication in the process using that.
When you've clicked complete, can you unclick it? I mean, can you add after it's completed or once it's completed?
Yes, that's a great question. Basically, so here, this is sort of just... this is just a check. I can unclick that save and it's removed. I can also, you can see in here, we added a directive. And let's say I come in here and I save this and I said the directive has been completed. And then I came in here and actually removed this. This basically will turn yellow. And what that means is that I've indicated it's completed, but it's empty. And it could be the case that this patient does not have a directive, right? And that's fine. This is just as a warning to you to basically say, make sure that that's what it should be. But yeah, this is by no means set in stone. I can always come back in here, uncheck this. Even after the patient, this is discharged and they're given their booklet, I can always open this record up again and modify the after hospital care plan. And that's also a good case where if someone's doing that, you'd want to know who is doing that. Any other questions? Yes.
She got scared there for a minute.
They raise their hand and just wait. No, it's great.
Can this be integrated to our current CPRS as a legal in the medical records? Because we have the CPRS, which is our legal.
I'm not familiar with what that is, but we are having conversations to try and get as much of it integrated as we can. Was that something you're talking about, data flowing into this or data flowing out of this?
Sorry, to be determined.
I think what she's saying is once it's completed, and that's what we had mentioned earlier about it could be a PDF and then put into Vista tools.
Right. Yeah. I mean, this is an electronic document, so that would be a conversation we'd have with your IT folks to figure out, how we can make that happen. It's absolutely technologically possible.
Okay, just warning, this mic is horrible.
There are some free text boxes that you have right now. How are you dealing with those in the translation?
Yep, and there is an explicit warning here.
Warning, okay. There, like Doug was saying, there are things that we want people to watch for, like signs of infection and fever, and there's no place to do that right now, or Clorox catheters, and I mean, I guess that could go under equipment, but
yeah. So typically, every site is different, so we do the best we can to sort of tailor the software to, your specific needs. But we also encourage people to write on the booklet. It's not, we want them to, interact with it and be comfortable with it. If it's just static material, it's not as useful. So we want it to be like a workbook, right? That being said, if there's a way that we can incorporate information that has commonly been having to be written onto the booklet into the software, we'll, jump at that opportunity to improve the software, especially if it's something with static content that needs to be translated and they're encountering that problem over and over again. So we would just work with you to figure out what needs to appear in the booklet and how it should look. Thank you. Yes.
Is there any option for interface once the patient's left the hospital, for example, in the PCP office?
That's something that we're looking at. Right now we don't have something, but this is a scenario where that's definitely something we would like to do. It makes a lot of sense, and it would be a conversation again with IT to figure out, how we can get this information over there, and then, how we make this after hospital care plan available to them. We'd love to do that.
How is this captured in the electronic medical record? Because I know we've had issues in the past about what we give patients for patient education and then how that's documented, especially if you're talking about handwriting on the booklet after
right,
which I think is perfectly appropriate, but can you talk a little bit about the what's then left as documentation?
Right. So the short answer is that's TBD. That's a conversation we need to have with, what are your requirements there and what is technologically possible. We're willing to work with you all to figure out however you need that to be in your EMR, we can make that happen. If it's a matter of, flowing this data back in, or if it's just putting the PDF in there, obviously we want to avoid having to scan the booklet and put that in a folder somewhere, right? So that's to be determined, but that is a conversation I know that we're having.
I apologize for missing the very beginning of this. I was stuck in the real world. Is this just, we're trying to avoid readmission, so this person is being discharged. What happens with this record? Is it cumulative? If she comes back a week later, is this still here?
Yes, we actually have a feature in here where you can say new visit, and it will pull in the data from the previous booklet into this. You can start a new booklet starting with that data, and then you can just change it from there. The existing record is not changed. It's a copy that you then build on top of.
And this just can grow forever?
So that's also an IT conversation as to how we back up the data, where it goes after, a period of time, how we archive that, because obviously, the space on the server is not indefinite. But the goal for the end user goal for the nurses using the software is that they can pull data in from a previous visit.
I would say that the whole area of transitions in care is kind of morphing into care of chronic complex patients. So across the board, that's what's happening. It started out as, and for Project Red 10 years ago, we started out with how can we care for people when they leave the hospital until that first PCP visit. That was the goal. And that the software and the after hospital care plan was to prepare them at discharge to get to that first visit. Because once the medicines change, then you need a different tool altogether because it has to be changed. So, this after hospital care plan software is now being modified so it can be changed and can be out there. And as the Lasix goes from 20 to 40, it can be adapted. But the future is caring for complex patients over time, so that, if it was on some sort of a platform somewhere where the provider can access it, the VNA can access this, the cardiologist can access it, et cetera, and that if I change the Lasix from 20 to 40, the other members of the care team can see that, and it stays relevant forever. That's the future of all this stuff. There's no question about that. And that this product was built to get to that first piece, and that's really important. But then in the future, there'll be more and more of this integration among members of the team, everybody doing different things, even to the extent where the VNA can make a list of the things that they're doing. As they do them, they check it off. The CPAP machine arrived at home, and that the wound was changed, the dressings were changed today, that kind of thing. So other people the cardiologist can come in and say, echocardiogram came back, and I recommend doing this to the medicines and that to the medicines. It can be in real time, especially for these highly complex patients, because it's not just that one readmission to prevent, but keeping them out of the hospital long term. It's like a hint of the future, I think, where we're going with all this.
Let's say they're ready to go, but later on, just about to leave, they miss something. It's already pre-printed. Who's the last person to give it to the patient?
Right. So that's a process question. So this is a tool to be used in the process. We still have to go through and identify, the roles, right? So, for instance, I mentioned at the end of this, I'm going to hit, discharge, print the final booklet, and now the draft watermark is removed, and I have the booklet. You print it in a color printer, it's spiral bound, given to the patient. And then let's say like that scenario comes up, or let's say there's a medication change. These are parts of this process that is to be developed where it says who owns that part, who owns giving that to the patient, who owns delivering the education on top of the booklet. If there is a change, then you would identify who's responsible for that. This software is just basically, doesn't know what's going on with the entire process. This software just is a tool to create the booklet. And so I can always come back in here, change something, and print it again. But as far as identifying who does that, that's more of a conversation we would have when we're, actually implementing this in your site.
This is kind of a technical question, but we're curious, how does it get spiral bound? I mean, if it's, is there a special printer on every unit or
binding machine?
But there's a binding machine on, like, at each point of care?
That's a good question. That's sort of like an implementation question. Yeah. So some sites will choose one area where there's a color printer, binding machine, or multiple areas, and then maybe everyone has to go there to do that. Maybe there's one in multiple places. I mean, that's more of a cost versus whatever concern. So that's something that we would work out in terms of rolling this out on your site.
Rosemary, we thought you could just strap one to the back and.
Yeah.
Right. I think we can get that for you. I don't have that off the top of my head.
Okay, thank you.
$275.
No, he's negotiating. That wasn't a statement. So I mean, yeah, typically we can get the paper pre-punched, so it's a pretty quick process to just we put a cover on the back that has a folder in it, spiral bound, it's a pretty good presentation. And we have sites where they have any additional materials, maybe additional education materials or the existing discharge summary, they just slip that into the pocket at the back.
And actually, in reality, this broke, I think. Oh, is that it? Oh, there it goes. I didn't even realize that I thought that was just your demo, the one that's spiral bound. But I find that the tool is going to be extremely useful even without the spiral binding, believe it or not. I think that's an added plus. I didn't know that we were going to be looking at that. But regardless, even if it's stapled and not bound, it's a great product for us.
This is not a legal medical document. Although you're saying in the future sometimes this might be useful to join medical systems together. But I keep hearing over and over again, but we can go back and change it. That makes me really nervous. Did I keep hearing you say that? We can go back and change records. But this isn't a record, right? But if somebody comes back in the hospital, so is there some way of securing this also? I mean.
So the application is secured with a login, and we do have a whole user management system to determine who has access to it. But in terms of the legal questions, I mean, I can't really answer that. It would be, whatever your requirements are. But like I said, so we do have a couple of things to help with that. We have the audit log of everything that's happening. And then on an additional visit, we never actually change the previous visit's data. It's like we copy that as a starting point for the next visit's data. So the previous visit maintains its state. And then basically, when you print the final booklet and give that to the patient and you don't come in and change that, we have a record of what the booklet that was given to the patient, what that was. So we can always go back and print that again and say this is what was given to the patient. But I understand your concern there and your questions there, and I think that's an interesting legal conversation to happen about what the requirements are. We have, what other languages is the question? We have Spanish to Chinese today. And then this is an area where if there are additional languages, that's a feature that we can deploy for you all. And then I think the next one on our list was Russian. I'm not sure about that, but I think Russian was the next one. So that's something. Oh, yeah. I don't know if you can read that well. So, there's a question here, yeah.
Will this print out a provider version of this that you could then fax to them that may not have all the pictures and, it would just shorten and abbreviate it? Do you know what I mean? Or is it the same product that comes out all the time?
This is the same product that comes out. There's not a PCP flavor of this today.
And we have an EMR that goes across PCPs and inpatients, we could pull it up in outpatient, right?
So, I mean, if I could design it, I would have it done that way. It's just a matter of what we're able to do with your system and how we want it to work. It's an ongoing conversation. We know that the goal is to make that happen. It's just how it happens and what the system allows us to do. Sure, but right. I mean, it hasn't even been determined, how the mechanism to do that or what they actually want to see, if they want the booklet, if they want the data, all these are to be determined.
With all this information put together and print out, this too much for the patient to absorb or take it home?
I'm sorry, can you say that again?
With all this information put together, is it too much for the information for the patients?
Too much information for the patient. You want to answer that?
Is to summarize the information that we think is necessary for the patient to know, and to package it in a way that they can understand it, and in a way that it can be taught efficiently.
I don't think your mic is on.
Oh, okay, sorry. And that certainly there could be a whole lot more information that we could think about, results of lab tests and echocardiograms and all that sort of stuff. We chose not to put that into this book because this is a tool for the patient to use to take care of themselves when they go home, or for the family to assist them in doing that. So we tried to make those difficult decisions about what goes in it, what doesn't go in it, based on what the patient really needs to know, and not more and not less. You could argue about both of those things, but that's where we are right now. I think it's a big step forward over a lot of things that are out there now.
Any other questions? Great. That was the interactive portion of the presentation. The last thing we can do here is manually add a medication. I'm not sure if this is something that we'll be doing, if we can get the discharge medication list to flow from the EMR, but I just want to show you how this works. So again, I begin typing, and I have a list of options here. I can select that. Add in a dosage here. How many? Now again, we have a series of drop downs here. We're selecting values, so we'll just choose tablets, for instance, series of routes, by mouth. Let's say for 6 to 8 hours. Now you'll notice here we have a bunch of options. Once a day, twice a day. And in the booklet, we actually color code these by time of day. And so if I do something like twice a day, 3 times a day, I actually check off which times I want this to be taken here. Or I can choose something like as directed by your doctor here, and this will appear at the bottom of the list in orange, and just it won't be color coded by time of day, it'll just be orange. Or I can say take this 6 to 8 hours as needed, and click this PRN here. Reason for taking, I have a bunch of reasons here. I can just choose pain, series of restrictions, anything do not crush before or after meals, do not drink alcohol, new or existing prescription. We can choose to display both the brand and generic names, the brand name or just the generic name in the booklet. And I can prescribe this for a set number of days if that's necessary. And then when I hit save here, we see Tylenol appears over in this list, and this is sorted by brand name, and that's why I popped in there. And so this, I'll show you how this appears in the booklet. And so we added this as a PRN. So at the bottom of this list in white, take this medication only if you need it for pain. Every 6 to 8 hours if you need it. By mouth, do not drink alcohol when taking this medication. So that is a pretty simple example of adding a medication using this software.
It's also possible to work hard on doing prednisone tapers, which is high-risk medication. That's also, I mean, you don't need to go through it all.
Yeah, that's actually something in our next release. So we're constantly working on this software. So we've been talking about a lot of customizations today. Typically when we deploy a new site, we gather up all the feedback of, hey, it'd be great, we really need this, this, and this to go live. And then we'll put that into the software and we'll set you guys up for your go live. Then we actually do a quarterly release. So every few months we're going to be releasing an updated version of the software, and that's not a forced thing, it's an optional thing if you'd like to take the update or not. And this is sort of a bubble up of what all the sites are asking for. And in our next release, some of the things we're going to have, we're looking at sliding scale insulin. We're looking at multiple tapers. So right now you can do one, but having multiple tapering medications. We're looking at things like non-standard frequencies. So, take this Monday, Thursday, Friday or something, and then displaying those in the calendar, right? And then some other medication functionality. And then we're also looking at a weight table so that you have like a red, yellow, green, yellow, red, and so you can keep the weight within a certain limit. So a bunch of things we're doing. We're always working on the software, and basically, to be honest, the louder you are about a feature that you need, the better possibility it gets into the software. So keep that in mind. Is there a question here? Yeah.
I think David had mentioned that this is due to go live at a VA in another couple weeks. So do you know, does this interface with our CPRS?
That's the conversation that's ongoing right now.
So you still don't know that?
I don't know. Personally, no.
That's interesting.
Any other questions? All right. So I'll just mark the meds as completed here. Save this. This changes to patient ready for discharge. And we will discharge this patient. And now when I look at the discharge patient list, I see my patient has moved here. The active list they're removed from the active list, but I always have a fresh list of people who haven't received their booklets yet. Back on, are we going over a follow-up phone call? Okay. Okay. So one other thing here, I'll just quickly show you here. We have all the site data here listed. And so if I need to, for instance, add a PCP, the patient doesn't have their PCP in this list for some reason, I can always just come in here, new, MD, come in here, put this information, go back to my patient record, and it will be in the drop-down list, and I can add it to the after-hospital care plan. So that is, I think the key things I wanted to touch on. So we're not going to have a chance to come back then and do the follow-up phone call script then, so we should walk through it now. Okay. So once the patient's discharged, I can go to phone intervention, and they'll now show up in this list of people who are ready for their post-discharge phone call. So I can have their phone number here. I say start call, and then we have the script up here on the top right, and then we have these buttons that correspond to the patient responses. Now the way this works is, you see we plug in some data here. I'm reading this. Here I'm asking the patient if they have 15 minutes to talk. They say, yes, I can talk now. I click this, and then the script progresses to the next state. And so we use this format to basically go over their health status, their diagnosis, their medications, their appointments, handle any questions that they have, address any questions they have about taking their medications, identify any issues there. And then you'll notice that over on the left, as the caller, the data that was added to their after hospital care plan is popped over into the table on the left. So I'm asking them why they're in the hospital, and then I'm able to assess if they're correct or not because I have the answer effectively over on the left. So I ask why they're in the hospital, correct. What is the name of your main problem or primary diagnosis, correct. Has your main medical problem improved, worsened, changed? Let's say it's not changed. And so every time I click a button here, we track that response. So at the end of this phone call, I have a log of exactly how the phone call went. So I can say the patient, their health is not improved, they have no new problems, and I have a complete record of the phone call. Any new problems? No. Can you bring all of your medication to the telephone, please? And now over here I have a list of all of the medication we added to this patient's after hospital care plan for reference. And this gets pretty in-depth here. We go over every, we're asking them to bring all their medications to the telephone, also any herbal medications, and then choose one to start with. They bring it to the phone. What is the name? The name should be on the label. And there is some responsibility here for the caller to address any, obviously questions that are not part of, respond to a button here, or if they have any additional questions, then that's the responsibility of the caller to sort of handle those. Some things, this is a customizable script, and some of the things that we are looking at adding are, for instance, free text responses. So I can say, hey, the patient really had this question or this concern, and that will be entered in as part of the log. Because we do realize that, these conversations can become very dynamic, and the buttons won't really give you all the information you need sometimes. So, correct, what is the strength? You're walking them through getting all of the information about each of these medications. How do you take this? How often do you take it? What times? And so this is really correcting them while they're talking through this. So we won't walk through this entire script today. Let's say I can always go back to the previous question if, for instance, I hit the wrong button. I'll hit end call here and show you what this looks like back on the main menu. View phone call logs, Martha, and we have call started, able to state the reason for hospitalization, correctly state its diagnosis, etc., etc. So that is the follow-up phone call functionality in the software, and yes, there's a question.
So this kind of goes back to my earlier question. If you did not include it on the list, then how would you see it during the telephone call? Would there be another place to enter it so that just the person who's conducting the phone call could see the antivirals or the antipsychotics that were not listed when the client went home?
I think you mean like the example where the patient
Yes.
wanted family to know.
Yes.
I think in that case, the patient probably, you could have the information populated, but you wouldn't have printed out an actual care plan. So the caller has the information, the patient doesn't have the printout. But they should have their
Oh, I see. You just enter it after you do the printout for the client. You just enter it later so that it is there to address.
Well, I think also our Peggy's somewhere here. There she is. We currently, when she does that, she has Vista at her fingertips. So it's not that you wouldn't, be able to, for those patients, look at the right medication list. I think, again, that's just kind of like a process issue of how will we deal with that. The nation doesn't have to do it the same way we do it. Of course, we'll do it the best, but...
Any other questions on this follow-up phone call portion? Cool. So that is what I wanted to show here. And then some other things I'll just briefly touch on. Because we have all this data coming into this piece of software, and this is all stored on a database, we're able to sort of look at this data any way we want, right? There's all these statistics about patients that are being added into this database. And so we're able to say, you know, hey, how are we implementing RED? Is there room for improvement? Are we, you know, for instance, creating completed after hospital care plans? How often are we sending people home without their PCPs? How often are we, you know, creating booklets that don't have the discharge med, that don't have their appointments? And so we have a solution that sits on a SharePoint site on your network. You're able to access this from a browser, and you're able to look at the real-time statistics of your implementation. So you're able to see by week, for instance, how many patients are going home without their PCPs. And this is something that you can track over time. You can set goals at this and say, we want everybody to be going home with their PCP set by this date. And then this is the way to make sure you're trending towards that goal. This is something that we do for every component of the after hospital care plan. So PCP, diagnosis, are people being sent home without their diagnosis set? Follow-up appointments, and of course medication. And so we literally have all this data, and there are so many different ways to slice and dice this. So this is our current reporting solution, but again, this is a lot of room for improvement, something that we're looking in for the next version, filtering by diagnosis, filtering by patient demographic, filtering by site or area of a hospital. So those are some of the things we're looking at. If there are any specific reports that you think would be very useful, that's something that, again, we would just add to this site. You log in and you're able to track the status of your implementation. So this is a pretty handy way of doing this, and this is, again, a benefit of having the software as opposed to a manual solution. Is there a question?
Yeah, regarding the diagnoses, it's a drop-down menu, right, for the diagnoses?
Correct.
Have people run into problems with translating a diagnosis? Sometimes the people who write the orders write some kind of creative diagnoses that aren't really diagnoses.
So typically what we actually find the bigger problem is that what's coming in from the EMR is the admission diagnosis, and we don't have the discharge diagnosis. So there's that problem, and then there's the problem of, yes, it's some shorthand. Sometimes it's coming over. We have sites where the stuff is coming over in Spanish, and so the booklet will be as good as the data that we put into it. So if there is data that is coming over in a strange way, that would be part of the clinical process improvement we would look at to figure out, how we put data into the EMR so that it can flow over here correctly. And then where there are places like for instance, if you put something into your existing software and every single time it calls it CHF, we would just add a mapping to our piece that says CHF translated back to the full diagnosis for the patient. So it's a lot of stuff that we can do with software, but generally if it's free text, that's part of the process improvement to figure out how we can make it more standardized. I don't know if that answers your question or perfect. Any other questions? Great. Well, that is all I have. And I will be at the back of the room if you have any other questions.
Great. As we transition to have Dr. Jack and Jessica speak to the next part. Oh, actually, it's just Dr.